And today, Kansas City, Missouri City Council is going to vote on whether to extend the indoor mask mandate. Council committee recommended extending it until October 7th yesterday. The city's health director says that case numbers show the mandate works. Also, the ACLU of Missouri wants to intervene in the state lawsuit against mask mandates in schools. Attorney General Eric Schmidt's trying to prevent schools from creating mandates. He argues that masks could hinder children's development and the mandates take away parents' right to make choices for their families. Well, the ACLU argues that universal masking protects all children, especially those with disabilities and medical conditions that put them at a higher risk for severe COVID. ACLU says that schools are required by federal law to accommodate those children. And we expect to hear from a Jackson County judge today about the future of Ray's Cafe. The county health department was forced to go the legal route after the Blue Springs Cafe spent weeks refusing to enforce the county's mask mandate. Well, Ray's is open as a private club. They say it's their way around the mask rule. And a Kansas middle schooler has died from COVID-19. They're the third child to die from the virus in the state. The state's health department shows 72 active school outbreaks across Kansas. And meanwhile, in Missouri, COVID-19 testing rates keep falling. Right now, 9.9% of COVID tests are coming back positive. The Kansas rate is now at 8.7%. These numbers are the lowest they have seen in both states this month. And meanwhile, with fall comes cold and flu season. Add in the fact we're in a pandemic. Well, how do you know if it's a common cold or COVID? Doctors at the University of Kansas Health System say you can't be too vigilant, especially with COVID being so prevalent right now.
So I think if you develop symptoms, go get tested. You can do the home testing. You can go to other minute clinics or things of that nature, hospital testing sites, health department health testing sites. We have a testing site here at the health system as well. If you have any symptoms, it's important to go test.
Just one day after the FDA authorized Pfizer booster shots for millions of at-risk Americans, the CDC's advisory panel today is going to have its say on who falls into that category. ABC's Faith Abube has the latest.
Right now, scientists on a CDC advisory panel debating which Americans can get a third shot of Pfizer's COVID vaccine. The FDA deciding late Wednesday the shots can be administered to older Americans and those at high risk of getting the virus. That includes healthcare workers, teachers, daycare staff, grocery store employees, and people in homeless shelters and prisons. The CDC now working out a more detailed recommendation.
Hopefully, Director Walensky will come out on Friday and give those final recommendations about who is at high risk and who exactly should be getting these booster shots, including those above the age of 65. For everyone else, we just need more data. People need to wait.
So far, the only people that have received booster shots are those with compromised immune systems who received the Pfizer or Moderna vaccines. An estimated 2 million people who qualify have already gotten a booster, including Allison Rogers, who has Crohn's disease.
If you've already gotten the second one, the third one is kind of a breeze. I got it on a Saturday, and by Monday I was back at work.
While the booster shot debate continues, fewer and fewer Americans are open to getting vaccinated. The White House estimates 71 million Americans who are eligible still haven't gotten the shot. Data also shows COVID patients are dying at a significantly higher rate in states with low vaccination rates. In Montana, Billings Clinic administrators say their ICUs are running at 150 to 175% capacity.
So we have ICU patients outside of our intensive care unit in other areas of our hospital. We're used to dealing with death, but death in younger people who have children, it's incredibly hard on our staff.
And those who qualify could begin getting their shots by the end of the week. Early data shows the booster shots are safe and that side effects are similar to what people experience after getting their second shots. Now, requests from Moderna and Johnson & Johnson to offer booster shots to the larger population are still pending. FDA could make a decision on those within weeks.